Greetings. My name is Haus Ngyumpa. I work as an administrator at Marvin Minor, where I coordinate patient care with local hospitals and clinics, most of which now use the electronic health recorder system. I would like to take this opportunity to explain to you the essential part of electronic healthcare as recorder as well as related advantage and issues so that you can become familiar with this technology. This the main topic we'll be discussing is introduction to healthcare recorder, describe two components of healthcare recorder that support direct clinical and explain associated benefit and issues. Describe two components of healthcare recorder that support administrative process and explain the associated benefit and issues. Describe the importance of of the integration of the administrative and clinical area for effective use of an electronic healthcare recorder. Let's talk about the introduction of a healthcare recorder. A healthcare recorder is an electronic equivalent of a patient recorder. A healthcare recorder are patient-centered, authentic recorder that make patient data immediately and safely accessible to authorized users. A healthcare recorder system is designed to go beyond the normal medical data collected in a within a healthcare provider office and can include a more comprehensive views of a patient care. One of the main features of healthcare recorder is approved provider can build and manage health data into a digital format that can be shared with other healthcare providers all over multiple healthcare organizations. Let's take some description of two components of healthcare recorder that support direct clinical care data. Let's talk about medical prescription and or an order of lab tests. If you submit your prescription, the system can inform you if the prescription may cause an allergy reaction or medical adverse event. That's one of the benefits. A patient prescription can be lost as it is delivered immediately to the pharmacy. You can refill multiple medication faster and effectively. You can immediately command, diagnose, and lab tests from computers. Second, remote access. Secure access patient record from outside the office. Finish your work at home without having to transport a pile of shards from the office. The benefit associated, healthcare recorders allow easy storage of data and prevent the loss of paper recorder. Healthcare recorders allow patients to access their data, which can allow them to adopt a lifestyle according to their health status. A healthcare recorder decreases the risk of medical error as they are easy to read and interpret. Let's go with the issues associated with it. The healthcare recorder system require constant maintenance and record update after patient visit, which can be costly. Seems you're gonna add money for people to repair, to update those information. When a healthcare recorder is implemented, there is a serious risk of liability concerning medical recorder. For example, can be lost or damaged in the transition from paper-based to digitalized healthcare recorder system. This might result in medical errors. Patient access to healthcare record may lead to self-medication, which can be risky in a case of a serious diseases. Let's talk about the description of two components of healthcare recorder: the electron an electronic healthcare recorder that support administrative process. Let's talk about management. Enhance office communication by assigning duties digital by tracking the taken to finish them. Instantly record the patient's wait time and identify bottleneck at your facility, examine healthcare provider and staff output to assess staff performance. Now let's go to the privacy and security and look at it. Size, privacy notice, and inform constant digital and linking them to the patient record. This saves space and make it easier to evaluate the important form. Audit trail are automatic saved and only authorized persons have access to them. This trail record each time a patient file is viewed or modified, as well as the person who carry out the action and the computer used to carry it out. Each staff member access rules are updated and maintained in an electronic healthcare support in electronic healthcare recorder support role-based access, which allow you to choose which selection of recorder each member of your team can have access to. The benefit associated to it, the benefit of lower cost of transcription, the benefit of lower throughput, storage and refilling cost, the benefit of enhanced documentation and automated coding capability, the issue associated with it. There is high risk of being hacked, which can result in the loss of patient records and medical error. There is a need to train the staff to use the electronic healthcare record system, and this can be costly to practice. There will be workflow interpretation due to need of learning a new system, which can lead to loss of productivity. Let's look at the other main point that we talk, the importance of the integration of administrative and clinical area of effective use of electronic healthcare recorder. Due to the obvious general beneficial impact it can have on both areas, the integration of administrative and clinical area is critical for effective use of an electronic healthcare recorder. The electronic healthcare recorder system not only promotes the flow of healthcare delivery, but also aids in administrative and clinical area. Some of its advantages in this area include reduced medical error, improved communication between physician and patient, which translate to improved treatment engagement from the patient in the healthcare through patient portal, reducing loss of medical data, billing error, and more storage space, and etc. The benefit from the advantage those advantage, it's important to take care of administrative and clinical aspect of the electronic healthcare recorder system through regular maintenance, update and training. For employees, for effective use, the system brings many benefits to healthcare delivery, which is why it's important to integrate effectively the electronic healthcare record in the administrative and the clinical area. Thank you for being with me. I hope you liked it, and welcome to your another video about health with me.